Payunk Medical supply a range of insulated needles with a choice of tips that may be used for single-shot nerve or plexus blocks, or through which a catheter may be passed to provide repeatable or prolonged analgesia. There is also a stimulating catheter that is used as a monopolar electrode to demonstrate that the catheter continues to lie in close approximation to the nerve or plexus as it is advanced out of the tip of the needle. The advantage of using the stimulating catheter is that accurate and optimal catheter placement may be verified before local anesthetic is injected, thus ensuring a successful block using minimal doses of local anesthetic. In addition, the catheter position may be verified by repeating electrical stimulation each time the local anesthetic action has regressed. Before commencing a peripheral nerve or plexus block, attention should be paid to how local anesthetic systemic toxicity might be safely treated. Besides the local anesthetic drugs, there should be available an anticonvulsant, anticholinergic, IV induction agent, and a short-acting muscle relaxant. This video demonstrates the use of a stimulating catheter for an axillary approach to the brachial plexus. The patient had sustained a wrist fracture of her dominant hand some 9 months previously, and although satisfactory union had occurred, she had limited finger and wrist movement due to pain and had been unable to tolerate the physiotherapy that her orthopedic surgeon felt was necessary to improve function. In this situation, brachial plexus analgesia may be used to allow aggressive physiotherapy, and a catheter technique would allow this to take place over a number of days.
If it's uncomfortable, just say. Because it's not until the end that we actually put any local anaesthetic in. Do you want to lie yourself absolutely straight? That's it. That's it. And pop that hand comfortably up there. Demonstrate when the needle is in the right position, the catheter is exiting the hub when we've got to the 2 mark. So if we were to pass it to the 3 mark, it would be some 10 centimetres into the plexus. Now to stimulate as we put the catheter in, we'll actually need the catheter out of the sheath and with the lower lock connection fitted. So in the 5 cc syringe we've got a saline. In the 10 cc syringes we've got local anaesthetic. Just going to gently feel the artery between the flexors and the extensors of the elbow. So I'm starting about 2 centimetres distal to the base of the axilla. Palpating the artery, and I'm making a small transverse subcutaneous injection of local anaesthetic. So the stimulator cable has been in alcohol so that it's sterile. Because it's a 2E tip needle, we'll need to make a small nick in the skin. So again, I palpate the artery. Draw the skin above the artery and make a small nick in the skin. Switch the stimulator onto 2 milliamps, please. Lovely, and then press the top left-hand button. goes to 0, and then when we make contact with the skin, it should come back up to 2 milliamps. The electrode wire goes into the hub of the needle opposite the tip of the tube, the open tip of the tube. So into the previously made small nick in the skin. Let me know if there's anything uncomfortable. We're stimulating on 2 milliamps. We're going to imagine that we pass the needle across the superior face of the artery. That's radial stimulation, with extension of the fingers and the thumb and extension of the wrist. And that's flexion. That's probably more that we want. Can you turn the current down, please? Is that 1 milliamp?
It's a 1 milliamp.
Slightly withdrawing the needle. That's probably adequate for our requirements. I'm now going to aspirate, make sure there's no blood.
Open the plexus sheath with normal saline. Stimulation disappears due to physically displacing the plexus from the needle tip, but it is easier to pass the catheter if the sheath has been opened with fluid rather than trying to pass the catheter dry.
Thread the catheter into the needle. And attach the catheter now to the stimulator. Can you turn the current up to 2, please? And then pass the catheter into the plexus. Reattach this, so we're getting no stimulation. So we'll reapply that. Yeah, we're getting stimulation now. So I've incorrectly applied the hub.
Stimulate on 2.
Stimulating on 2 milliamps. Withdraw the catheter. That's radial stimulation. Advance the catheter. We've now advanced the catheter some 10 centimetres and we're getting stimulation of the pectoral muscles on her chest wall. Advance the catheter a little bit more. Although it doesn't easily want to go. Can you feel that stimulating just in your... And we've got stimulation of the fingers, so if we can show that. So we've got stimulation of the fingers, showing that we've got probably median stimulation, because we've got some pronation. We've also got stimulation of the chest wall, showing that we're stimulating the branches of the plexus to the pectoral muscles, which actually come off at the coracoid process. We've passed 10 centimetres of catheter into the plexus, so that the catheter is probably lying at the level of the coracoid process. So we'll now inject some local anaesthetic. I'll turn that over carefully. I can now inject into the same system. Fingers flexing. I can aspirate, no blood, and inject. And the stimulation goes immediately. Screw that a little bit tighter. Aspirate again. And inject. Slightly difficult to inject. You'd expect that for a very small catheter. We're injecting prilocaine so that she'll get analgesia, surgical analgesia for 2 hours, and analgesia sufficient for her physiotherapy for a further 2 hours. But at the end of 4 hours it should be wearing off when we can re-stimulate the catheter to check the position of the catheter. Should have top-ups daily to allow aggressive physiotherapy. So I'll inject 20 cc's of prilocaine through the catheter in this position. We can switch the stimulator off now, because it will no longer be able to stimulate. I'll remove the needle and we'll put an oxide dressing on. The system is very neat and convenient because it's easy to attach the catheter, the stimulating catheter, to the compression hub that is specialised to allow you to inject and to stimulate. And it was interesting to see that the stimulator was able to tell us that the connection was incorrect, because it actually reads the current flowing rather than the current that you've set. So we'll put an oxide dressing on that, just a small one first. It has been very good. That again was another very easy demonstration of it working, which surprises me. It will be helpful later today to know that the catheter is in the right place. And on subsequent occasions when we top you up every day, to tell us that the catheter has stayed in the correct position. So we need a miniature filter, please. Thanks. Which is supplied in the pack. We'll prime that with local anaesthetic. And this should ensure that the injections remain sterile for the week that we do the physiotherapy. Then if subsequently we wanted to stimulate, we can apply the electrode. With this arm, do you want to just touch my fingers?
Which arm?
Your right arm.
I feel the tongue weight.
Does it feel a ton weight? That's excellent, well done. That's the block beginning to work then. So we'll pop that down. Do you want to move your fingers? How does that feel?
Comfortable.
Right. And then what
It's
we'll
tingly
do...
a bit.
Bit tingly because the block's working.
Mm-hmm.
But in half an hour that'll be a full block and the physiotherapist will be able to do the physio for you.
Great.
That's good. Pop it down on your chest. That's
Okay.
finished.
Okay, thank you. I woke up this morning and it was the best my hands felt after yesterday's physio.
Good.
Because normally I wake up and it's hot and swollen and stiff.
Right. If you just pop your hand down on your tummy, that's good.
At foot pressure.
And we'll just get the stimulator. Tell me when you can feel a tingle.
There.
And then at 1.4. Top-ups are with 20 cc's of 0.25% L-bupivacaine to allow aggressive physiotherapy for up to 8 hours. If pain relief is required in the evening, a further 20 cc top-up may be used. An X-ray of the axilla with the injection of 5 cc's of Niapam 200 through the catheter shows the spread of dye between the coracoid process and extending to the first rib under the clavicle. The catheter tip at this level ensures a predictable and complete block of the brachial plexus. Payunk Medical Technology produce a range of equipment suitable for regional anaesthetic techniques using nerve stimulation to aid accurate localization. A range of needle tips and lengths are manufactured through which catheters may be passed for prolonged analgesia. A choice of stimulating or non-stimulating catheters are available. The facet-tipped needle
with a 20-degree bevel allows easy passage of a catheter when the needle is in the same axis as the nerve or plexus. This would include an axillary approach to the brachial plexus or a block of the femoral nerve. The TUI tip or sprot tip allow the catheter to exit at an angle which may be useful for interscalene and vertical infraclavicular approaches to the brachial plexus, or with a catheter technique for the lumbar plexus.